All right, my name is Phil Coburn. As we record this, I'm 75 years old. I had my first heart attack a little over 2 years ago while driving into Del Rio to see the new version of the Alamo movie. Of course, I was taken to the hospital, and Dr. de Blasi, at that time, became my cardiologist. And that as time passed, I had two additional seizures. And after another series of tests, it was determined that I was really not a candidate for surgery. The blockage in my heart was a small valve in the back of my heart, which would be extremely difficult and probably not worth trying to put a stent in. So he recommended this ECP program, which I had never heard of. We talked about it a bit. He gave me a brochure, which I took home and studied. I took it, I talked it over with my wife, and we decided that I should give this a try. EECP stands for External Electric Counter Pulsation. And as I describe it to other people, it's like putting, I think, blood pressure cuffs. They're somewhat larger, of course, but put blood pressure cuffs on your calves, on your thighs, and then a larger one around your buttocks. And you're hooked up to a machine, and these cuffs inflate and deflate opposite to the inflation and deflation of your heart. And what it does is it forces more blood from your extremities back into your heart. The treatment consists of 35 one-hour sessions. When I signed up for it, my wife accompanied me to the first one because I had no idea how I would feel afterwards, and perhaps she would have to drive me home. I was amazed how good I felt after the first treatment. I was stunned. When we got home, we talked about it and I tried really to calm myself down, just make sure I'm not fooling myself here. But I really did feel a tremendous difference. And my wife even commented it was the first time that she had seen color in my face for some time.
I was going to comment on the fact that when he walked out after his first one, that I took a look at him and I was amazed. He had color in his face for the first time in years. This is the reason that I wanted to go and have the treatments.
I can honestly say I felt better and better and better after each treatment. I can't really stress how good I felt after these treatments are over. Now it's been 2+ years, and I still feel really tremendously good.
Now, I'm 6.5 years older than he is. I have had and I still have a lot of health problems that he does not have. I have a very high pain threshold, and I have to really be almost at the top of a pain level before I ever feel it. So one morning I got out of bed, put my feet on the floor, and I had excruciating pain in my knee, which resulted in a complete knee replacement. I feel if I hadn't been going through those treatments, I probably would not have recovered as well as I did from the knee replacement. My surgeon that did the replacement was amazed at my age that I came through and did as well as I did. I had that knee replacement when I was 80 years old, and when I was having the therapy, I noticed one day that they had my age down as 70. And I said to the technician, I'm not 70 years old, I'm 80 years old. And he said, well, all of the exercises and your whole physical therapy sessions have been set up for a 70-year-old. Do you want me to redo it and make it for 80? You're doing fabulous. And I said, no, if I can keep up with it, that's the way to go.
Before I had these treatments, I'm very much a golf addict, and I like to play 3 or 4 times a week. I could play 9 holes with a cart and come home and have to take a nap. Now I play 18 holes, come home, and look for something else to do. My brother, who's 2 years younger than I, had his first heart attack when he was only 59, and that. So I was not surprised that I've had some heart problems. I feel that this procedure is probably, I'm going to live a little bit longer, maybe a lot longer than what the other men in my life have, in my family have. I'm extremely enthusiastic about it. I'm very impressed with the treatment. The other thing that I can note is when Dr. DeBlasi started treating me, I was taking up to 7 prescriptions. Now, after taking this ECP, I'm down to 2 prescriptions, and just recently he cut the dosage of those 2 in half.
I would recommend it highly to anybody. I think we're so fortunate to have Dr. DeBlasi in our community, that he has the knowledge to bring in those beds for these treatments. And I can't say enough for Eliza. She's very, very competent. I feel that his nurses and he have done wonders for our community, and I would recommend them to any and everybody for a healthier life.
I would, without reservation, recommend anyone to think seriously and perhaps take this ECP. It is an outstanding, I think it's a life-saving procedure. I can't get over just how much better I feel. Matter of fact, when I completed the treatment, I was telling people I felt like a 15-year-old. And then I got to thinking, well, maybe that's stretching it a little bit, so I said 20. Well, one of Dr. DeBlasi's office staff, who takes my blood pressure and such when I come in for checkups, told me I had the blood pressure of a 25-year-old. Therefore, I've settled on the fact that I feel like I'm 25 again, and I think I'm going to feel 25 for a long, long time.
All right.
He said everything I was going to say.